Schizophrenia is one of also the major mental illnesses. Is when this person often is you lose touch with reality. You are in your own world. You are hearing voices in your head. You are seeing things other people can't see. You believe in things like Mark, say, somebody is bewitching you, somebody is outside there to harm you, the police are outside here, don't you see them? They're here, I saw their cars, all this. You start closing all the doors, windows, everywhere, and then you switch off the light because there are cameras watching you. People throw around words, people terminology that they have no idea what it means and what it can mean to the person, telling you, this person is bipolar, this person has schizophrenia, this person has depression, simply because they lost a grandmother, they are sad. You are trying to tell them again now you have depression. Depression in itself, these are major mental illnesses. You need to understand that for you to make that diagnosis, the doctor has to take time with you, understand the criteria, and ask you these questions. Once you meet the criteria, and tell you that, in my opinion, in my understanding as a psychiatrist, this is what is going on in your brain. Anyone who has a brain is at risk of having a mental illness.
I'm your host here. I know you haven't seen me, or maybe you haven't seen me on the official web. My name is Bint Aisha. I am a woman of a lot of hats, but for today, I am the host of a beautiful, beautiful conversation with a beautiful human being, a psychiatrist called Dr. Hillow. So I'm gonna let him introduce himself so that you guys can know the man behind the mic today. Yes, hi Doc.
Hi, thank you,
Tell
Aisha.
us a little bit about yourself.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. Hillow Muhammad. I am a psychiatrist. I work in the government facilities. I work in Mathari National Hospital, referral hospital, and the biggest mental hospital in the country. So that is where I work for the public. And privately, I do private practice, notably in Nairobi South Hospital, BBS Mall, for example, third floor. I have a clinic there, and other private practices are also there, also in Garissa and in Irvine Hospital and the likes. Yes.
So for the people who are, especially when it comes to mental health, debunking mental health, our topic being mental health in the Somali community and in the Muslim community at large, why psychiatry? Psychiatry is
Okay. For the audience, I think we said we will mix the both Somali and English so that we're able to capture as many of our audiences as possible. I am a psychiatrist since I started doing psychiatry in 2018 in Mo University, Eldoret, where I initially did my undergraduate as a doctor. Once I finished my undergraduate, I went to do internship in Meru, where I've seen the challenges that people face, especially our community. People come to the hospital clearly with a psychiatric illnesses, but don't want to see a psychiatrist, with the fear that they will be labeled, they will be given diagnosis that they want to face, or they will be started on medications and all that. So they will be more than willing to see a general practitioner or any other doctor. And whenever they are referred, they might not be able to go and see that other doctor. So I saw some few challenges among our community there. Then I went to practice as a general practitioner, medical officer in Wajir Referral Hospital. That's where now I saw the need to have a psychiatrist. The biggest need to have a psychiatrist. So I said, why not? There was no Somali psychiatrist, and in the whole region, I have been for the longest, I think, and when I became a psychiatrist, they only having psychiatrists there. And currently, actually, up to now, there's no other psychiatrist. I go there and try to help those patients. So, Marka, that need, the gap is so huge that there's no single psychiatrist. So you can imagine how these patients face. And again, the myths thrive. The myths among our community, or even the Muslim community, thrives in lack of information. When you don't have the information out there, when you don't give them the right wordings for what they are feeling, everyone will just give you their own perspective of how they think or explanations or accounts of other people how they felt. So the myths are that this is jinni, this is the well, this is sihr, this is whatever it is, or you are faking it. There's nothing called mental health, there's mental illnesses, and all that. Clearly, somebody is exhibiting a major mental illness, and you are downplaying, and you are telling them to go seek help where there is no help. So you need to bring them to the right formal channel for them to be diagnosed and taken through the whole process, and for them to make an understanding of what is going on in their life. So that is why I went into psychiatry. Yes.
That's interesting.
Yes.
Now it brings me to the second question. Handadka Soomaalida oo fiirinayaan hadda. What would you tell them about mental health?
Wallahi Soomaalida waxaan dhihi lahaa horta hadda markii inta bukaanka horta ii imaatay iyo dadka qaarkood maaragtay oo fahmeen xanuunkan inuu xanuun jiri u yahay. Maxay leeyihiin xanuunada maskaxda ku dhaca dadka Soomaalida ma garanayaan. Waxay nin walba san ku sheegay, nin walba wax u tafsiiranaya. Ninkan sidan inta markii lagu keenayo qofkii waa mar maaragtay oo xogo maaragtay waqti uu ka soo dhumay oo lagu keeno waa waqti let's say san ku sheegay wax ugu daran horta ay Soomaalida u aqaanta xanuunka maskaxda waa waalni. waalli waxay u aqaanaan qofkii markuu maryo tuuray uu isgaranaynin qashinka guranaya cidi imaanaynin qabaysanaynin waxba cunaynin, that is when they say qofka uu waalan yahay. waalnida bas ay u aqaanaan xanuunka maskaxda. Anything else wax kasta oo maaragtay maskaxda ku dhici kara ayaga uma xisaabsan badana inta u badan yihiin. Laakiin alxamdulillah dadka way soo baranayaan, way ogaanayaan inay yihiin waalnida kilax masan xanuunka maskaxda ku dhacay inay ahayn tan waalnidan bas oo maaragtay qofka maryaha u tuuray. maxay la qofkan waxa ku dhici karta hurdo la'aan bas oo insomnia, hurdo la'aan kilax laga yaabaa inuu hays oo noloshiisa caadi sida kale u fiican tahay. waxaa laga yaabaa in oo maalin walba uu la soo kacayo walwal iyo walbahaar iyo naxtin iyo wax noocaas anxiety uu qabo. waxaa dhici karta qofkan inuu depression uu mari hayo oo maaragtay heer uu gaarayo macnaha in nolosha macaan ay lahayn oo uu rabo inuu isdilo ama maaragtay uu wax isku yeel macnaha oo noloshiisa khatar gelinayso. waxaa dhici karta inuu balwad galo, substance use uu galo oo isku dayo bal qof ifahmaya ma lahan because nin walba wuxuu dhaaka quraan akhriso masaajidka gal ilaahay isku xir way fiican tahay shay fiican waay. laakiin qofkii asaga ma arki hayo in oo masaajidka duu galo concentrationkiisa uu kitaabku kala furi lahaa ma waxayaba. qofku wuxuu u baahan yahay mogtahay in oo maskaxdiisa ay degan tahay, uu dhisay shay qabo, hurdo fiican uu soo helay, uu isfahmi hayo, markaas ayuu kitaab kala furi karaa. marka mar walba adhaado ka orad masaajidka gal marka tii ka cajisaya wuxuu sameeyaa marka inuu masaajidkan aad u qodho koona uu ka baxa oo balwad u bilaabo soo qaad cunaya sigaar cabaya bangi cabaya qamra bilaabo ee la arkaya. kuwaas ay markay u malayaan inay faa'iido ku jirto taas intii laga gaaro oo qofkii istaala lagu xiro marka ugu horo quraankana hadii la saarayo ay noqoto qofkii quraan in la saaro quraanka daaway waa shay ugu fiican ilaahay u nasiyo alxamdulillah. مسلمين دان تاس عقيدنا ديالته واي قفك القرآن كي أصلي هدي ما أنت وسكو آخرين كريم قفك وجود وقراوات إنك آخرين واي. لكن ما كان هذا وحنكو جينا يا شيخ بلو ومشى كجو ومنباس جو وإنت لام بجيرة أو كسماعي جيرة إثيوبيا جيرة ما نقول نسمع هذا الشيء صحيح. ما كان the only thing إن القف كان لقد عاد وحاول حنون كانوا حنون جيرة واي نوم والبقى مسكح له أو إلهي برين أوسي حنون وكل عكرة حنونا مسكح كل عندك مكلا صوعان they don't choose who to attack. They don't say that you have this kind of color, you are this race, you are this. You are more likely to become depressed. Depression no walba usi manyahay. So marka depression ki waxa ku dhici kara dad maaragtay waxyaalo qofkii uu soo maray ay dhici karta, genetic factors iska jiri kara, stressful events iska jiri kara. marka waxyaalahaas ayaga qofkii uu ku dhici hayo in oo intii la isku keeno laga hadlo laga caabiyo hadii daawo u baahan daawo lagu bilaabo sidaas ay muhiim ku noqonaysaa. marka in short xanuunaha Soomaalida hadda ay u fahmayaan maaragtay in oo waali kala ma ahan xanuunaha maskaxda ku dhaco idilbo in maaragtay si fiican loogu sheego ay ogaadaan xanuunaha inay jiraan. qaar waxaa jira ilmaha ku dhaco, qaar waxaa jira balwada ay keento, qaar waxaa jira dadka weyn ee ku dhaco. qofka hadda markuu 60 u gaaro oo kala laga yaabo in xogo maaragtay memorygiisa iyo fahankiisa hoos u dhaco. so doqnimada kala ma ahan waxa dhici kara xanuuno kale jiraan. hadda dementia oo kale ta qofka haduu early onset uu ku bilaawdo soo 60 jir waxaa fiican in laga horgaaro waxoogaa maaragtay sifo uu qofka iskugu darsamin oo maskaxda ay usii yaraanin ee usii dhumin inkastoo uu yahay chronic condition laakiin xanuunkaas waxaa symptomska qaarkood waa laga daaweyn karaa laakiin waxaa arkaysaa qofkii oo dementia qaba oo haddana psychotic illness qabo ama haddana physical illness ay kusii dhici karto pressure uu qabi karaa maxaa qofka intuu sii weynaanaya ayuu xanuunahan kalena usii nugul yahay soo sokoraa ku dhici kartaa waxaa ku dhici karaa cancer waxaa ku dhici karaa pressure haddana xanuunka kala sii jira so markaan waxaasoo culeys oo saaran qofkii ayaa weli guri iskaga haysaa aad rabin marka inaad geyso inaad maaragtay xarumaha caafimaadka oo daawo laga siiyo marka
Now, which brings us to one of the things that we've talked about here is you've mentioned anxiety, depression, or dadka fiirinaya or they've never had what anxiety or depression is, but they've had a lot of people use it. معناها a lot of the youth nowadays keep on bringing you here, oh, I have anxiety, I have depression, which is quite a heavy thing. Maybe you could just get deeply into that.
Okay.
In terms of depression, what exactly is depression and how far can it go? Even with suicidal ideation or Somali, we've seen a rise in the suicidal ideation and even the people who are dying by suicide.
Okay.
How exactly could you talk about anxiety, depression in regards to that?
Okay. Horta, yes, you are right. People throw around words, people terminology that they have no idea what it means and what it can mean to the person, telling you, this person is bipolar, this person has schizophrenia, this person has depression. Simply because they lost a grandmother, they are sad. You are trying to tell them again now you have depression. Marka depression in itself, horta waxan waa xanuuno maskax ku dhaco. These are major mental illnesses. You need to understand that for you to make that diagnosis, the doctor has to take time with you, understand the criteria, and ask you these questions. Once you meet the criteria and tell you that, in my opinion, in my understanding as a psychiatrist, this is what is going on in your brain, and this is what is going on in your life, and what is happening is that depression is one, there is low mood that persists, that is there. You wake up low, maintain the whole day, go back to bed again. Okay? You are not able to enjoy life the way you used to enjoy. Getting up in the morning, having that cup of coffee, going again for your classes, doing your hobbies, swimming, whatever you want to do, no longer makes sense to you. You get? You start losing weight. Your appetite goes down. You become, your concentration is low. You're not able to focus in life. You're not able to make sense of whatever that is going on around you, interacting with people, you see. And then comes the hopelessness, the worthlessness, the feeling that you are not worth living, the feeling that you lose hope in life. Again, you can go ahead and have other symptoms like suicidal ideations where you have attempts or whatever that goes on. Those are big major symptoms that you can watch out for in patients who have depression. So the doctor will ask you these questions: do you have this the last 2 weeks? How long did it persist? Were you able to enjoy this life? What's going on? So once the criteria is met, you're told you have a major depressive disorder, for example. The affective disorders are many, but we're taking an example of a major depressive disorder. So once you have this, you have met 5 of these criteria, and of this criteria, and you are told this is now depression.
Okay.
So what do we do from there? There's hope. It doesn't mean that being given a diagnosis of a major depressive disorder is a death sentence. No, there's hope, and a good one for that. In that, there are medications you can start with, because in your brain, what is going on is the changes of chemicals in the brain. You see, the happy hormones, the hormones that will have given you this hope you're looking for, and all that sometimes can go low. So you're given medications that will increase some of these chemicals in your brain, and you'll be able to again understand and have some insight and have a good feeling again. So once you give you an option of the medications, we have older generation medications and the newer generation medications, and medication depending on the costing and availability of how this patient can afford. You give them all the options and the best options that are there, and then they choose from there. Or as a doctor, you recommend and tell them, this is how they feel. If you can afford this medication, please start this. Again, you start therapy on them. Okay? Their patients, you can't tell them to do therapy alone because of the severity of the condition. You can't wait. A patient who is having suicidal ideation every day, every minute, only therapy won't take that out. Okay? So you tell them that let's start medication to shorten this, give you a good prognosis, and be able to be on your feet. Then we do therapy, you continue with it. So once you combine therapy plus medications, this person can have their footings again, okay, and enjoy life. That is example of depression. Again, somebody who doesn't have that, the whole of that criteria is telling you I'm depressed, okay, or somebody else is telling them this is depression, or you're just throwing out around words. But what I tell people is, once you know you have a condition, what you're feeling, it might be very hard for somebody who has not seen, who has not experienced those symptoms before, to make sense of those symptoms, or even explain. How will somebody explain to maybe a parent or in school, or even a supervisor at work, that I feel low all the time? What is low? What do you mean your mood is low? Go enjoy yourself, whatever. So that is when now people tell you, go start now, hang around with people. Yes, you see, yes. So people start talking about the material things. A newly married, maybe couple, the wife is having this continued. She's asked, and Mu'tad why say ma ludaqani why bil mad why say all this. So without understanding the deeper meaning of what she's feeling, and even she doesn't have words to explain. You see, so marka. The words we're throwing around, come and ask the right professional. You see, if you feel depressed, you feel sad, you feel low, all this, come and ask, do I have depression? Is there hope? Can I do something? Then suffering in silence. And by the time you're coming out is when now it's a bit late. You see, again, anxiety, for example. Imagine waking up every day in the middle of the night, ومشتوكة تويبو واسكون حسن توا سبودي والبحار you can't explain ما حكو سوكي ما قرنيسيت وردكم من قوني كرتي ما أنت لما سكو ريغنيسا فرت هذا كو ريغنيسا you see, so you feel that you're about to die, and you don't know what is causing this. You see, ما قرن كرتي. Those are symptoms of anxiety. Anxiety مركب وحي أو يفرق بذني معناها anxiety types كذا. wixii keenaya way iska badan karaan, laakiin badanaa mid ugu badan waa generalized anxiety disorder. Qofkii uu garanaynin wixii keenaya laakiin uu dareemaya wadna qaraac fara badan, walbahaar, naxtin, all that. Then it goes now again to a depressive episode, and then it becomes a mixed episode, whatever it is. Again qofkii marka uu baahan yahay in oo anxiolytics mise daawo laga sii la dejiyo horta maskaxdiisii marka uu qaboobo ka bacdi now loo sameeyo therapy. You see, marka therapy kala isku darana uu saa ugu fiicnaado. Tan kaleeta waa midda Soomaali ilaa wali schizophrenia, for example. Schizophrenia yaa qaba inaan wax yar u qaato. Let me take time with it. Schizophrenia is one of also the major mental illnesses. Is when this person, qofkan ay garanaya, is you lose touch with reality. You are in your own world. You are hearing voices in your head. You are seeing things other people can't see. You believe in things like somebody is bewitching you, somebody is outside there to harm you, the police are outside here, don't you see them, they're here, I saw their cars, all this. You start closing all the doors, windows, everywhere, and then you switch off the light because there are cameras watching you. You see, believing in that. Having that negative symptoms where you are not able to talk to people, the inertia that is there, the inability to even come out and socialize with people, not taking a shower, not eating. You basically isolate yourself in your own world. Okay? So, qofki, when they are experiencing that, the more they stay in that state, the more their dopamine continues to go high and the brain changes. The structural brain changes happen. So qofki, even if you were to start them on medication later on, you won't get them the pre-morbid state they were on before. So marka waxa fiican when you see such big symptoms, instead of first, you see, jinni iyo dabeel iyo waxaas can be a diagnosis of exclusion. In that markaad wax kale aad waysay oo dhakhtar u tagtay, you went to a psychiatrist, they told you you're fine, I don't see any, you don't meet any of those criteria, I don't see. waxaad rabto explain garaysa markaas. You get?
Okay, yeah.
waxaad rabto u raadso, yani explain whatever you want.
Let it be the last option, not the first option.
Yes. But now tell me why a 13-year-old who is having prodromal symptoms of these psychotic illnesses is taken through a lot of processes where la qaraaci, dabeel, dhagax looga qaylini, chemicals loo marini, ilaa oo maaragtay faruuriyaha ku di'ee bararaan, la tumi, ilaa isku naxdo mar walba ay ka qaado even PTSD, post-traumatic stress disorder ay ka qaado. mar walba oo aadaan ay maqasho. waxaan arkay gabar 15-year-old istalkay ku imaatay klinik Soomaaliya haddii aadaan u dhaco iyadoo dhan way qaboobi. dhagaa lagu qaylin jiray, dhagaa lagu aadaan maayo. Yes, speakers lagu shiday. marka wixii oo maaragtay quraankaasaan ku sheegay waa daawo, waa shay fiican, waa shay maaragtay Ilaahay noo soo dejiyey, waa asaga naftiisa daawo waa shifaa. laakiin ha lagugu akhriyo ha ahaato qofka kuu akhrinayo inuu ahaado qof kuu dhow, qof oo aad aaminsan tahay, waxyaala kale lagu dareenin, qaraac iyo ul iyo waxaan iki kale ay ahayn, waxaas aan lagu samaynaynin ha ahaato ha lagu qaboojiyo qofkii, halana loo nasteexeeyo, daawadii sidaas maaragtay ayuu ugu noqonaya. laakiin haddii la dhaho qofa waxay ku tiri dameer xarkiisa lagu shidi qiiq ahaan, then she's asthmatic, she goes into an episode having an asthmatic attack. qofkii qofkan waa qof oo lay person, waa sheekh ma garanaya, uu ku akhri ma garanaya markaas asthma symptomskiisi maxaa loo qaadanaya, she's having an asthmatic attack, waxaa la jinniga bixaya. imagine up until oo haddii gabadhiiba ay blue noqotay, symptomska ay bedel markaa isla loo orday oxygen wixii marka la keenaya. marka waxyaalahaas iyaga waxa looga bixi karaa in la fahmo horta xanuunkan, in oo lasla shaqayn karo, quraankiina la siin karo, daawooyinkan la siin karo. labadii shay markii la isku daro way fiicnaanaysaa. marka waxyaalahaas ayaa ka mid ah maaragtay Soomaaliya inay fahantaan rabi. Yes.
So which brings us to the next question in regards to schizophrenia, horta. When we're talking about schizophrenia, is it usually associated with the chemical imbalance in the brain, or what exactly is it? Because a lot of people think schizophrenia is your entire brain is just
it's gone.
Yeah, it's gone.
It's gone, yes.
But it's usually not, that's not the right thing, yeah?
Yes, it's
so
not.
I would want us to talk about in regards to that, to explain to a lot of the parents, because one of the greatest things that comes with schizophrenia is how many relapses people have. And it's usually very... if medication is working, why are they relapsing every single time?
Yes,
and it's going back to
yes.
So could we now tackle that?
Okay. No, so as I said, schizophrenia is a major mental illness and is a chronic condition. You see, chronic conditions are relapsing. You see, they come, go. In that you don't heal, as in you don't say that you are out of the woods. Medications can suppress the symptoms, can help you be on your feet again, continue with your life, but rarely, I'm saying rarely, will you be off medications in your life. It's like the same way somebody having diabetes or hypertension. Rarely will you be off your medications. But the people who have hypertension or diabetes are more comfortable taking their medications and continuing with it because they know they clearly see the sugar goes up if I leave my medications. But convincing them that when you are okay, still you have to be I might reduce the dose, yes. As a doctor, I will tell you first time you come in, this is schizophrenia, having these symptoms. You see, there's a whole criteria you have to meet. And I tell you that having these symptoms this condition is called schizophrenia. I'll tell you this is a chronic condition, which means we will start medications and you might have to continue with these medications forever. Okay? So once you tell them this and you psychoeducate them, they understand that this is being a chronic condition, it means I have to be on this forever. It makes their life easier to adapt and continue with it. You might change from one medication to the other depending on how it works. You might change from an injection to an oral medication or an oral to an injection depending on how it works. Or you might be on one medication forever but on different doses. You get? Depending on how the symptoms are. But the person has to understand that we have to choose what works for you, and you have to be on it for almost forever. Okay? But the person who has to understand this again is the relatives. Because a Hoyo comes to you and tells you, my 13-year-old cannot be on this medication, Dr. Tell me something else. You see, if you sugarcoat, if you tell them otherwise, they will start believing other things. The point is, there is hope. There are people who have been on it for 20, 30, 40, 50 years, continuing with it, with the medications and working normally, achieving their normal expected daily activities of living. You see, but if I tell you once you are okay, we can stop the medication, you will relapse again. Again, the symptoms will come back. Again, you will go look for another doctor, and then another medication that has other side effects can be started, and then you will start losing hope. Because these are chemical changes in the brain, as you said. These changes, if we don't give you medication, the change will again come up. You see, and if we continue having these changes, the balancing is not achieved. Like your dopamine is still high, or your serotonin is still low or high, depending on what the symptoms you're feeling, there will be structural changes. And we don't want that to happen. You see, your brain shrinks, your memory is lost, you start losing executive functioning again, the brain, the way you used to think, the way you used to plan things will not be the same again. So we want you to have an intact brain, okay, with the least possible dose. That is not so much to ask. You see, there are people who are on 5, 6 medications. I don't want to give examples and try to justify why somebody else is on this medication, but there are people who are having, for example, a mental illness, a hypertension, a diabetes, a cancer, and they are taking all the 4. And somebody who has either depression or schizophrenia, when they're told to take this medication, only one medication that will make your life easier, they think it's so much to ask. It's because of the myths that are there. One is, this medication will make you a zombie.
Yes.
You take it, it will make you a zombie. You take it, you lose your memory.
Yes.
You take it, you get addicted to it. You take it, you will be on it forever. You see, it's better to have a functioning individual who is able to achieve their normal life than somebody who is chained in a house for 20, 30 years. I've seen this in medical camps. I've been in Nordistan, Balambala, Juzi. You see somebody, they don't want to take to the doctor. Imagine they have a whole sub-county here, the person, why? Because they know once the medication is started, what else are you looking for? You are already chaining this person. Why are you doing this to the person? Once the insight is lost, the next of kin has to take charge, has to understand this. But if you are associating this with other things, telling them that I don't want him to be seen by other community members, I don't want them to be exposed to the outside world, this is gene, it will go away. For how long will you be chaining the person? It's really unfair. You see, so marka Somalia waxaan dhihi lahaa meel walba ka dhacaysa. Everywhere there are people who are chained. I'm sure if you ask any Somali if they know anyone, especially neurodevelopmental disorders, ilmihi kusoo koreen, ilmaha jira guri la iskaga xiraya. So that way this of 1 or 2 persons ay garanayaan jira. Marka those people, there is help. Dawooyinka hadii la sidantooda qabsan lahayn inaad xirto maanta and you don't have to change them all through in their life. So for how long will you be doing that? Marka there is hope. The more you wait, the more you are worsening the condition. Insan ku sheegay waa isbedel ku dhacay maskaxdii.
So now, which brings me to one of the questions. I was reading on this recently, where someone said some of these diseases are genetical, like they can be.
Yes, I was to come to that. Thank you. For example, schizophrenia.
Yeah.
waxyaalo waxaa jiraan things that cannot be explained by genetics alone. For example, the probability or the risk of schizophrenia in the general population is 1%. boqolkiiba hal ayuu ku dhici karaa schizophrenia. If you have a non-twin sibling, qof walaalo ku dhacay, the other siblings have up to 10 to 12% chance of getting schizophrenia. You get? If you have a twin where the twin are sharing the genetic makeup, the DNA 100%, it's 47%.
Whoa.
Okay, that the other twin will get is one. If one gets, the other one getting is 47%. I will tell you the good side of this. Again, if one parent let's say the mother has schizophrenia, the offsprings getting one or the chance is 10 to 12% also. Both parents have schizophrenia, the chance of the offspring getting is 40%. Okay? The example of the twin is that when one twin gets, remember these are sharing 100% of the genetics. When one gets, the chance of the other one getting is 47%. It means there's 53% chance that it is caused by something else that is not genetic.
True. Okay.
You get 53% that is caused by environmental factors. Nutritional deficiencies, traumas that happen to people, exposure to the just nature happening to you. Okay? So if now you were to separate these twins, kankareta, and you don't expose them maybe to this, the chance is 53% they'll be normal. You get? So you don't just say that schizophrenia is genetic. No. There's something called the downward drift theory. That theory says that qofkan, majority qofkan schizophrenia, poverty plays a big role. Poverty. Because when in poor areas, trauma is high. The chance of in lagu tumo, lagu qaraaco, lagu xado, lagu kufsado is high. Nutritional deficiencies, the chance ukuwe on ugali peke yake throughout your life is very high. Nutrition sasa kugu dhacaysa. So that is why u badan tahay. Again, qofkii let's say high aha for other reasons, or they were high in their socioeconomic status, and they get schizophrenia through maybe a genetic link. Genetics can explain and and then qofkii they're not able to maintain their lifestyle because this is somebody who doesn't in their own world. They're hearing voices, they can go to work, they cannot function normally. So what happens? They cannot maintain their lifestyle. Haduu runda u degna maxaa shaqadii u gafe. Rentki ma bixin karo. Muxuu markii u socdo, they go back again to kii hore meeshuu joogay. Way isku imaanay. Haduu kor joogan uu soo degaya, haduu hoos joogan kor ma aadi karo. In terms because qofkan haduu mar ku dhaco ma meeshan buu joogaa. So poverty plays a big role.
Okay.
You get? So marka taas genetics kalax ma ahan. Waxaan ka hadlayaa on environmental factors that can cause maaragtay schizophrenia.
Okay.
Yes.
When you let's say you go to now Wajir and you're going for medical camps in the inside, what is one of the biggest myths you find and stigmas you keep on finding repetitively?
Yes.
And how exactly can we work as a community to break it?
Wow.
From a doctor's perspective.
Yes. Thank you. Marka horta what I see is not just medical camps, but when you go to a clinic, for example, you are sitting in a public facility.
Yeah.
And patient lagu keena Somali. By the time lagu keenayo, the mother will tell you, 10 sana ka hor, 10 years ago is when I saw these symptoms. You ask her, have you ever gone to a hospital? My pneumonia, I've never taken him to a hospital for a mental illness, for him to be checked. You ask, has he ever been on any medication? No. Imagine, I'm not just talking of even and this major other, like epilepsy, for example. Of our case who has been convulsing from the age of 3, had an age in 27 years old. You see all you ask them, have you ever been on any anticonvulsant? She tells you no. What's happening? Why is this devil not if you believe devil ay tahay at the internet sana maxaa usugaysa 27 years la nooleed intaas rafadaysa the same way aan ku sheegay bipolar schizophrenia patients by the time lagu keenayo they have really lost a huge chunk of their life or in terms of symptoms so there's something called untreated psychosis. It stays for long. Changes happen in the brain. Even if you started them on medications later in life, you might not get the good results you wanted, or when you were to start medication maybe 15 or 20 years ago.
So basically, when these chemical imbalances happen for a long period of time, they create a permanent change.
Permanent structural change in your brain.
Oh my.
Okay?
Yeah.
Where the brain shrinks. I cannot add substance to your brain. Your green matter, I cannot give you a boost in that.
Okay.
But I can just struggle with you and give you these medications, try to better your life, your quality of life and all that. The other myth, the other myth is fear of the diagnosis itself. Fear of the diagnosis itself.
Yeah.
Haddaan tago, the same way aan ku dhihi karaa cancer uu soo maray iyo HIV ay soo martay, dadka HIV haddii la sheegay may jeclaan jirin, ma istalka ma aadi jirin, because haddii lagu sheegay bal ka waran.
True.
I better die not knowing than no. Wax noocaas adiga, the fear of the diagnosis, inta ku imaada adhaahdo schizophrenia qabtay daawadan qaado yaa laga cararaya. So taas intaasay guri ku haynaysa maamadii ama qofkii geed laskaga xiraya ama shaqadii waynaya. Imagine the story will be the same. Waxa dhahay dukaan uu qabay, he was living in Kericho in where very vibrant businesses.
Yeah.
But you can see this person has lost. Intaas waxa dhihi qofkan school uu dhiganayay, he was doing medicine, uu kasoo tagay, uu kasoo cararay, intaan keenay quraan saaraan u bilawnay, intaan soo sameynay 20 sano hadda maraya. intaasaan geed ku xiray. Just imagine that. Inta geed ku xiraysa maxaad ku keeni waysa intaas hal mar lagu daaweyn lahaa. Maxaa yeelay haddii oo isbedelka uu dhacayo maskaxdii, chemicalka aan ku sheegay dopamine-kii kor u kacaya maskaxda gubiya. Maskaxda yaraanaysa markaa. So markay yaraato qofkii sidii ma ahaanaya. So that is mar walbaan ku celiya taas. Mar walbaan u sheegaa dadka intii aad dhibkan la noolaan lahayd forever. Qofkan aad ku rafaadi lahayd. Let him be independent. Qof aad u qabeynaysa oo 30 jir ah. qof aad masquusha ka dhaqaysa, qof aad maanta dhan u adayaysa oo ku soo fiirinaya. Waa catatonic saana ku fiirinaya karo iska fadhiya zombie. Marka zombie aad ka cararaysa daawada aad leedahay daawooyinka keenayaan qofkii xanuunka keenayaba. xanuunka dil daaweynin asiga keenay qofkii inuu si fiican u shaqeysan waayo oo haldi waayo oo dadka la xiriiri waayo. You get so waxaas waa waxyaalo ma artay Soomaalida ay inay fahamtay tahay oo ku turkuteen iska been iska aan waxba ka jirin marka in ay fahmaan oo lagu dhaqmo oo istaala qofka la keeno walaahi shaqaal fara badan jira ma sha Allah khayr Allah siiyo. I don't know Garis inuu gaarayo codkayga Sheekh Ibrahim Kabmuudi Sheekh fiican waa isaga Garis jooga Quraan bas qofka saaraya qofku arka waxan in mental illness uu yahay uu soo diraya daktari waxan quraanka lax ma baahno wuxuu baahan yahay daawo kaagee laakiin wixii waa arkaysaa waa saartay quraankii ama waxad horta Soomaalida alxamdulillah wixii ma aragtay oo quraanka ma ogi waxyaalahan kale oo sixir waxan oo aasi inay ku dhaqmaan qofka quraanka waa la saaraya laakiin waa lagu celcelinaa waa la wada marka waxan hadii oo uu yahay shay maskaxda xanuun uu yahay إلهي داوس وسارع فاسألوا أهل الذكر إن كنتم لا تعلمون وحن ضد بقى وصل آخر استيبا فان سمع 8 سنة أي سكول أوجد جري إن أنا برتو أن أوجاذو حنون كمحوي سمع علمي قاعد صدق إلهي أوسيي أذيك ما تبرنين ما كان بل ما هم لنا واحد إيش أقف كان حنون كان هايا دبايش أني واحد معهن إلكم أركي بل أنت كل علم 8 سنة قرأيسي 8 سنة دقيق وشيديسي 8 سنة waxaan ku sameynaysi isbedelka ma arkin inaad geeso aan hada bal dhakhtar gee ya u fiican marka 10 sano ay gaartay ma ahaba culimada waxa jirta dad qaarkood markay saas ay u arkaan qofkan in uu jin u yahay way garanaya inay il yahay way garanaya wuxuu dhahayaa ka u tag dhakhtar ka isbitaal aad saas markii ma daawo lagu bilaabi karaa qofkii lagu caawin karaa
su'aalka ugu dambeeya maxaan rabaa inaan ogaado. There's this supplement called ginkgo
biloba.
I'd like to know more about that in regards to
Somali ginkgo biloba ma aqaanto. Ginkgo biloba waa one of the marked wax loo isticmaali jiray in hal dhaha dementia iyo memory boosting iyo kale loo isticmaali jiray marka hore laakiin hadda waxa jira active elements oo isku dardara oo ginkgo biloba ay qabto daawo fiican waaye marka taas ayaa loo isticmaalaa in oo concentration fiican laga helo xogo qofkii maartay fahmidiisa ay soo baxdo you are able to concentrate and that waa one of the like a supplement oo loo isticmaalo. It's not an active molecule or sida hadda let's say an antidepressant oo aan ku caawinaya ma aha but waa one of the supplements oo loo isticmaalo sida magnesium iyo calcium iyo adoo isticmaal vitamin D
But it's good for the brain.
Yes,
Okay.
it is.
So I would like for you to give Somalida or hadda firinayaan. Waxaan rabaa inaa u sheegtid
Af Soomaali ku hadal.
af Soomaali kula hadal.
Mhm.
Mise af Ingiriis kula hadal. Tii aragtid. What would you tell them in regards to mental health as a psychiatrist, as an advice to them in regards to mental health?
Okay, and thank you. Horta, tan ugu horo aan dhihi karo waxaa waaye, the first step is that anyone who has a brain is at risk of having a mental illness. Haibagui. Haijui wewe ni mkubwa, mrefu, mfupi, mnene, whatever it is. sidii ma aragtay qofkii haddii maanta lug aa ka jabta aad isla u aadaysa haddii maanta maskaxdii you see qof haddii or if something else is going on in your body if you have a fracture or you have pain anywhere else in the brain tells you minta ka xanuunaysa let's go to the hospital you go to a doctor that pain is fixed but the brain kada xanuunsan tahay symptoms lu ogaanay the person might not know dadka agtiisa ogaanaya changes in behavior this person believes in things that are not real. Is having a delusion. Okay? This person is not sleeping. This person is talking to self. He's hearing voices, all this. Waxaan qofkii ogaanaya agtiisa ayaa la rabaa marka in oo u ka caawiyo. Marka these are things that are real. Okay. Mental health inaan u qaadano shay ma aragtay oo sax oo aan dadka aan ka caawino istalaa ay imaadaan waa shay muhiim if you don't take it seriously and we are just believing in our own things, still continuing with the myths and the misconceptions, it really becomes hard to help the one in need. The people who have insight, the relatives, the next of kin, should be able to first seek help in a hospital before you decide this is the well or whatever you want to believe in. You see, let the professional tell you that I can't make a diagnosis because I don't see any. There's no psychopathology. Hanun kuguma arki aniga maskaxdaadi is okay. Maybe something else. Okay. Okay. Taas ayaan dhihi lahaa markaan Soomaalida.
Okay.
Marka waxaan rabaa inaan.
Is there anything you feel like you haven't talked about? You would like to add so that we can continue with it?
I wanted to give a comment about substance use among the Somali, among the youth, among the Somali. Horta substance use haddii laga hadlo gaar keligiis iyo haddii mental illness ahaan loo fiiriyo way kala tahay. Because a teenager at form 2, form 3, form 4 who has started experimenting on this and then wixii uu ka bixi karaa, yes. But there are people who have a mental illness, they're feeling these symptoms they cannot explain to their teacher or the parent. Because Somalia that fear is so we don't create that atmosphere where you see?
Yeah.
So qofki, whenever they're lacking sleep or they're feeling sad or they're talking to self or they're having just their brain is shut. They try to self-medicate with substances. You get? So the issue of which one was the chicken, which one was the egg comes into play.
Yeah.
Which came first? You see, I have seen many teenagers who have started this because of the sadness they're feeling, their brain, whatever symptoms, mental illnesses they are feeling. They are going into depression, they are having a psychotic symptom, especially in high school. Qofki, he started that. But once you don't have insight, you won't have that courage to seek help in terms of rehabilitation. You go deeper into the substance use to the extent you become addicted to those substances. You start having marijuana, then cigarettes, then cards, then energy drinks, whatever you want to do, then khamra. Then it continues.
As someone who's addicted to energy drinks, I feel called out.
You see, marka the addictions kal uu sheegaya horta lawa way. There's something called chemical addiction and behavioral addiction.
Okay.
Chemical addiction waa waxyaalaha la isticmaalo qofka oo isku dayo and they try to self-medicate with if they have a mental illness or if they started it as a result of just pleasure whatever nini and peer pressure ku bilaabeen waa gaarkeed. But maxaa ka mid ah the substances that are high at risk of that can give you that high risk of addiction, alcohol,
Okay.
cannabis, caffeine, and inhalants waa kuwan maaragtay gluuga, petrolka, paintka, any hydrocarbons kuwan wadada ay isticmaalaan kuwaas hadaa sii wada you can get addicted to it. Hallucinogens inta kuma badno balse waa waxyaalaha maaragtay ay maskaxda ku furan isticmaalaan isku dayaan in maaragtay they call hallucinogens. Then there are opioids. Hadda there is like a pandemic I have seen before steroids. Opioids waxaa ka mid ah dadka hadda isticmaalaya heroin oo kala. Tramadol is one big one now going on.
I've had the word tramadol being
Tramadol
that.
addiction hadda a lot of people gabdhaha you see a lady who has undergone a cesarean section was rightly started on let's say a painkiller tramadol. She takes it for 2-3 days, 4 days, 5 days.
And she's already
Then
addicted.
it is not stopped for one reason or the other, and then it's prolonged for a bit, kidogo. Then she's discharged. Somehow she will go to a next clinic and say, I'm in pain, I have this, yes, and then the injections continues. The dose is increased, tolerance happens, she continues, and she cannot stop. You get? Another one because of what is called dysmenorrhea, the periods, the cramps. Tramadol logu bilaw, it happens. Another one because of a fracture, tramadol logu bilaw. That is the explanation, the reasons why majority of the ladies I've seen tramadol logu bilawan.
Okay.
You get? Then they continue because now there's something called tolerance. Or those isticmali cannot give you the effect you wanted. So you have to go up and up and up and up until ceiling effect. You are not able to get the high or the feeling or the painkiller or xanuunka ka rabtay. So xanuunka ku sii badanaya. So you go to daawooyin kale marka. Ina magaco sheegay mar dad isticmaali kare. Daawooyin kale isticmaali oo ka sii weyn kuwaas. You get? So that is how ay ku bilaawaan. Balse waxaan rabaa inaan fahmo waxa waaye dadkan xanuunka maskaxda qabo oo asoo teenager because of depression substance u bilaaway haddii adhaha substance waan ka bixinayaa welina maskaxdii ay sidii u furneen and you're not giving them that help they need.
How exactly
are you going to even if you take them to rehab how many times way so behind depression is still there. The psychosis is still there. This has to be taken care of. Then you can take care of because what two things marka those are called the chemical addiction. Marka waxaan ku dhahay the tramadol, the opioids I'm talking about, the tobacco, the stimulants waxaa ka mid ah qaadka, cocaine-ka waxaan oo isticmaalayaan. Caffeine kan oo ku jira energy drinks. Yes, energy drinks waa very high. Caffeine-ka isagana addiction qaba oo ka mid ay tahay. Tobacco oo kale tuu la mid yahay. Waxaa kaloo jira marka these other ones steroids kada qarxiska isticmaalayaan si u socdaan marka it has a lot of effect, physical effect on the body. Okay? Marka those are called chemical addictions. This behavioral addiction waxaa ka mid waxaa ka mid gambling. People or either online or casinos or even whatever it is, gambling is one of them. There is internet. Okay? There is shopping. maanta dhan kab bay gedaysaa isoo bay kab soo gada in soo gada gimi soo gada wardrobe ku buuxa wala buuxay you continue.
That's new.
You see, then also the sex addiction or whatever it is by isticmaalaan pornography or whatever marka kuwaas jiraan. But the underlying problem is that the brain, the pathway they're using is the same. You're looking for that dopamine rush. One of the brain parts of the brain mar walba ka farxinaya xogo that is the same thing. The person looking for this alcohol and the person who's doing gambling, at the end of the day, the dopamine rush is what they're looking for. Okay? That is now you become a captive to your own brain. Now again, the frontal lobe again, waxa dhacaysa inuu soo yaraado qofkii dhugta ka dhumaysa.
Okay.
Ma fahmay. Dhug waa garasmo. That's what Somali say. Marka taa ayada waxay u baahan tahay in itself in qofkii laga caawiyo haddii uu yahay an underlying mental illness laga daawayo, but addiction in itself waa mental illness.
Okay.
Laga daawayo u baahan. Yes.
Now, which brings me to my last question in regards to our Somali youth and the people who are going through all these things. Is depression, anxiety, schizophrenia, or bipolar treatable? Because these things, most of the time, once you start on these medications, it never ends. Is it really treatable, or it's something you have to carry with you always?
Okay, it depends with the prognostic factors of if they're having that support they need. But by and large, these are chronic conditions. Being a chronic condition, you need to understand that you will be on medications or you will be on treatment one way or the other, be it therapy or medication, better part of your life. Okay, that doesn't mean anything in terms of giving you a bad prognosis. It means if we have another option, if now there is a new research, because mental health now, we have a lot of papers coming out every day. New research is being done. We're trying our best to have the best fix to some of these problems. Okay? Be it even the genetic modulation or whatever that will happen. But now the point is, if I make a diagnosis of this chronic condition, my role as a psychiatrist is to go through the whole understanding with the patient so that they know for how long will I be, all these questions I asked, for how long will I be on this condition, will I get used to it, will I be, are they affordable, will I be able to maintain this, is there a cheaper option, all these should be answered, okay? But the bottom line is, please take the advice of the doctor. If your condition is less severe, and therapy or only very low dose of a medication is able to help you, take that option than suffering in silence. Okay? So, marka tan aan rabo inay fahmaan waxa waaya, there's hope. There's hope. Science is advancing. There are newer medications, there are newer therapies, there are newer ways of doing things now. Marka, don't be isolated. Don't be looking for solutions where there are no solutions. There's solution in the mainstream healthcare system. There's solution in mental health. Come to us. We'll be able to see the best care that we can give you than saying, than fearing the diagnosis itself.
True.
I like to take time with my patients and explain to them one-on-one. This is where we are now, and this is where we are going. Okay? Come back. Let's see how you are faring. If the problem is the side effect, we'll try another medication that has a lesser side effect, if you can afford. There's another one, if you can afford. There is something else you can add, if you can tolerate. Okay? But by all means, don't suffer in silence. By all means. Yes.
So now you guys have had that. Your mind is a very important organ in your body that needs actual treatment when something is wrong. You cannot only treat it via religious pathways, which we do agree they do help, but treatment is treatment. Your body, as much as your kidney does need treatment, your mind does too. So thank you so much for joining us for this episode with our lovely, lovely psychiatrist. If you need more conversations in regards to, you can just drop a comment. You know where to get us. Follow, comment, share, all that is necessary. I'm your lovely host today, Bint Aisha. For more conversations, follow the Laughing Lab Coach podcast. Thank you, guys.
Thank you.
Signing.